section of the human body, starting with the nervous system. So when we talk about the nervous system, we're really talking about the brain, the spinal cord, and then what we call the peripheral nerves. The brain and spinal cord are the central nervous system, and everything else that comes off of it that allows us to move and allows us to feel are the peripheral nerves. So if you think of it like this, the finger doesn't know that something's hot. If it touches something, the finger doesn't say, oh, that's hot, I have to let go. It sends a message to the brain through those peripheral nerves, and then the brain in response says, I'll let go, dummy, that's hot. And so it's a transmission of that nervous system that allows that system to function. In the brain, we look at the largest part of the brain, the cerebrum, as being responsible for being like the computer of the body, for thinking, for voluntary actions, as well as involuntary actions. So from that cerebrum, the largest part of the brain, then we have the small brain, the cerebellum, and from there the brain stem that continues on through the spinal cord, and it runs inside the vertebrae of the spinal column, and then from that the peripheral nerves extend all throughout the body. That's how you have pain sometimes in your feet or your hands or a headache or whatever. All that information is going back to the brain. The digestive system, it's responsible for bringing in food, for nutrients for us, as well as excreting waste. So those nutrients are transmitted to all cells of the body, and we need constant, supply of sugar for energy, and whatever is left over is disposed of as waste. We've got different organs throughout the body that help in that digestive system, beginning at the mouth, running all the way through the anus. So from the mouth, the salivary glands help to start break down the food, and by that chewing, we break it down into smaller portions. We swallow, it goes down the throat to the esophagus, and the esophagus has wave-like contractions that keeps the food moving in one direction. In the stomach, we have hydrochloric acid, which is a very potent, very acidic acid that helps break down food, and it stores there until it's ready to pass through the small intestine. Nutrients are absorbed in the small intestine. It's real important to know. So if somebody takes a medication orally, it doesn't really start to work until it hits that small intestine. So some of the other medications that we give, of all of them, that's probably going to be the slowest route. In the large intestine, then, all of the nutrients are picked up in the small intestine. Whatever's left over continues on to the large intestine to where it's made into feces. When that stool hits the rectum, then we get the sensation that we need to find a restroom, and that stool passes through the anus. The whole process takes about 24 hours. So what you ate yesterday is what you're eliminating today. In the digestive system, you can kind of see exactly what I talked about, a visual from here, the long esophagus, and then the stomach over here. So let's not leave out some other digestive organs that help. We have the liver right here. It's very large. It sits in the right upper quadrant of the abdomen and kind of the lower part of the chest. And its function is to produce bile. It's an exocrine gland, which means that it helps with elimination of a lot of toxins in the body. Behind it, down here, is a little green sac called the gallbladder. And in the gallbladder, it stores the bile that's produced from the liver so that it helps break down food a lot better than just by itself. Now, you don't have to have a gallbladder. A lot of people have had them removed because they had pyloric problems, or they've had some gallstones or something like that. But if somebody has a gallbladder, that bile is emptied into the stomach. The pancreas kind of lies what we call retroperitoneal, toward the back. And the pancreas is responsible for secreting glycogen, glucagon, and just outright sugar for the body. Insulin for the body, not sugar, but insulin for the body. And it's that insulin that's required to help large sugar molecules pass from the bloodstream into those target tissues, into those organs like the brain, the heart, pretty much all the tissues where it's needed. So without insulin, some people have to take another form of insulin to help break down that sugar, and we call that diabetes. One thing to know about the abdominal organs is that some of them are hollow, some of them like we talked about, the stomach, gallbladder, small intestine, and large intestine. And if somebody has trauma, especially what we call blunt trauma, it's not penetrating, just blunt trauma, that causes those organs to rupture, whatever those contents are inside those organs will spill in to be shared with the rest of the organs. So that sometimes creates a bit of a problem. Your solid organs like the spleen is situated on the left upper quadrant, the liver on the right upper quadrant. They're very vascular. And if those are lacerated or rupture, it causes a lot of internal bleeding. So if you have somebody who's driving a car who gets T-boned on the driver's side and they have a bruise in that left upper quadrant, kind of tucked up under the ribs, we want to be really suspicious for a ruptured spleen. Whereas if they're the passenger and they get T-boned on the passenger side and they've got a bruise in that right upper quadrant, then we really want to be suspicious of bleeding from the liver. The pancreas is a solid organ, and then the kidneys. And the kidneys are tucked up under the back of the flank, kind of protected by the ribs. If you like boxing and you see that rabbit punches are illegal, it's because those rabbit punches go right into the kidneys and they can actually fracture the kidneys. So bruising on that flank area, kind of toward the posterior part of the body, we would suspect a kidney injury. And we worry about those solid organs because they're so vascular and the person can bleed out very fast from those. A little bit on the genitourinary system, responsible for filtering the body's fluids and removing waste from that. So male reproductive organs, and this is really the only time we talk about it in this class. We have a little section on a woman in labor and delivery or gynecological problems. So we talk about the female reproductive system a little bit more than we do the male. This is pretty much what we're going to say. In trauma, the male genitalia can be injured, and we treat it as a soft tissue injury. So not a whole lot that we would address there. The female reproductive system, again, we cover it a lot with our labor and delivery and our gynecological, but basically on the lower abdominal quadrants, right and left, lie the ovaries. And those produce eggs, which pass through to the uterus. If unfertilized, then the woman will have menstruation every 28 days. If they become fertilized, and usually it becomes fertilized in the fallopian tubes, but attaches to the uterine wall, and that's real important there that's where it's supposed to be, not outside of that area. The last thing, this is called genitourinary, so not only reproductive but urinary. The kidneys filter about 180 liters of fluid a day. Most of that is recycled into the body. Some of it is eliminated as waste, as urine. When the bladder gets about 200 milliliters, so about half the size of a can of soda of urine, then we feel the urge to urinate. Some people can go longer periods of time without urinating than others. I call it the bladders of steel and the bladders of glass. But basically it's a filtration process. So without the kidneys, somebody can live, but they would have to go on dialysis to filter that same amount of fluid. The skin is an organ. In fact, it's the largest organ in the body. It covers all parts of the body and has three main functions. It protects the body from stuff getting in, and it keeps stuff in the body. It also regulates temperature. If you've ever noticed when you're really cold that you look down at your arms and that you can't really see your veins as well because the blood is shunted to the core keeping you warm, whereas on a hot day your veins look like pipes because it's trying to dissipate that heat. It also is a sensory organ, so it transmits information from the outside environment to the brain. Remember me touching whatever that was hot? That's transmission of that information. There's main two layers of the skin, and then underneath the skin is the fatty layer that we call subcutaneous tissue. So the very outer layer is epidermis. For the most part, it's dead skin layers, the most outer layer of the skin. The skin itself is called the dermis. It's a little deeper layer, and looking at this picture, you can see the layer of the epidermis way out here, and then the dermis, it contains the hair follicles, sweat glands, sebaceous gland, nerve endings, blood vessels, all of this kind of stuff. This is really what we call the skin. The epidermis is just kind of a watertight seal that keeps everything in. Below that, you see these little yellow circly looking things. Those are adipose tissue or subcutaneous tissue. So depending on what part of the body it is, we tend to collect more fat than others. Like on my forehead, I have no fat. The bad thing about that is if I walk into something and I bump my scalp, there's nothing there to absorb that energy, and the scalp being very vascular will bleed a lot. If I use that same force and I bumped with my butt, it has a lot of padding back there, and it absorbs that energy, so there's probably not even going to be a bruise. Then down below that layer of subcutaneous tissue, we have the fascia, the muscle, and then below the muscle, the bone. If you've ever seen somebody skin an animal, a deer, or you've skinned one yourself, and they pull that hide away, they're pulling the skin, and that fascia and cutting it is separating the skin from that muscle layer. It's a good barrier, and as long as it's not broken, it's probably the best barrier. But on all calls, we're going to wear gloves because you never know when that barrier is going to be broken. You can have a little scratch and then you have an opening where pathogens can invade. The skin is sensitive to touch, pressure, pain, and then hot and cold. A little bit on growth and life development. So from very infancy, from a newborn to a neonate, which is the first 28 days of life, all the way to infancy, which is the first year of life. And then we talk about toddlerhood and preschool and school age and adolescence and young adults, middle adults, older adults, and then geriatrics. So when you look at that stages of life and the growth and development at each step, number one, we'll treat, as healthcare professionals and as EMS providers, we'll treat the different stages of life differently. And, you know, if I'm talking to a 3-year-old, it may be a good idea that I get down to their eye level, communicate with them on terms that they understand. If I'm speaking to someone my own age, you know, middle age, I would want to, you know, converse with them, explain things very well. And maybe somebody who's older, I may want to slow down my speech a little bit, be patient with them. They may not always be forthcoming with everything that they need to tell me. So all of these in here, the body changes constantly. There's growth and development the whole way, as well as certain expectations that we kind of expect to see. Now that's not to say, especially when we get to geriatrics, that all geriatrics are hard of hearing and they can't see and they have memory problems. And it's kind of neat to know that 95% of geriatrics actually live in the home. They do not live with assisted living or in nursing homes, and they may live with a caregiver, they may live with a family member, but they do all right on their own. A little bit on vital signs. We've got a section on that from the patient assessment, but the three main what we call common vital signs are the pulse, which is your heart rate, respiratory rate, and blood pressure. So we come up with normal ranges for each of those so we can anticipate what that patient's normal should be or their abnormal would be. Vital signs change with age. The smaller somebody is, the faster their heart rate and the faster their respiratory rate. The smaller someone is, the lower the blood pressure. And we actually have maximums on blood pressure. So even though somebody is very large or they're older, it doesn't mean that their blood pressure keeps increasing, not necessarily. So it shows you vital sign values based on infant, children, and adults. It's good to know adult range for heart rate is 60 to 100, respiratory range is 12 to 20, and blood pressure, the systolic, anything below 90, we call it hypo. Hypo means low tension, hypotension, or low blood pressure. Anything over 140 systolic, we call it hyper. Hyper means high, hypertension, high blood pressure. We can also look at some other factors on vital signs. You know, just besides those three, we've got pulse oximetry now. We've got level of consciousness. We've got pupillary response to light. So we're going to add all of those things as we check people's vital signs. And looking at knowing that any variation they have may be caused by some external factors. So summary, respiratory system, We covered that. Consists of the lung and the airway. The circulatory system consists of the heart, the vessels, the blood, and a little bit of that pulmonary system. We actually call it the cardiopulmonary system. The skeletal system consists of bones and ligaments, cartilage and tendons. The muscular system, we talked about skeletal muscle, which is voluntary. I want to move it, so it moves when I want it to. Involuntary, which are the smooth muscles. The pupillary response to light. The diaphragm, the intestines, some examples of smooth muscles. And then the cardiac muscle, which is not only involuntary but works through automaticity. The nervous system consists of the brain, spinal cord, and then the nerve endings. We talked about the digestive system and its role in giving the body nutrients as well as eliminating waste. The genitourinary system, which we'll discuss reproductive system for women at a later time, but we also talked about kidneys and the excretion of urine. Skin protects the body from the environment. It's also a sensory organism. And lastly, we talked a little bit about vital signs, and we'll touch on that a little bit more in another section. So for a review, which of the following patients is in the anatomic position? A man lying on his back with his arms across his chest? No, we said he needed to be standing. A woman standing and facing you with arms at the sides, thumbs pointing outward, so it would be in that direction, and that looks like it's the anatomical position. It's always good if you find a test question you like to keep going and make sure there's not a better one. A child on her left side with her right knee pulled towards her stomach, that wouldn't be it. A man facing you with his feet 12 inches apart and his hands interlocked behind his head. I guess something like that. That would not be correct. So it looks like B is going to be our best answer. When referring to the human body, the term proximal means, so it's having to do with arms and the legs, closest to the point where an arm or leg is attached. I like that. Proximity. Position that is closer to the feet, and that term would be inferior. A position to the back of the body, and that term would be posterior, connected to the pelvis. The best answer for us is going to be A, closest to the point of attachment. Respiratory system is responsible for transporting oxygenated blood throughout the body. I like that. Oh, transporting. No, that takes that away, doesn't it? Transporting oxygenated blood sounds like it's circulatory system. Ensuring that the body has an adequate supply of red blood cells. That sounds still like circulatory system. Removing carbon monoxide from the body. Well, carbon monoxide shouldn't be in the body, so that's not it. Providing oxygen for the body and removing carbon dioxide. That sounds like the best answer for the respiratory system. So that wraps up all of the human body.